What state are you most likely to die in from COVID? That's a statistic I would pay attention to. What state has the least hospital beds to accommodate those who are sick from COVID, even if they're not going to die from COVID? I would want to know that. I'm not going to base a decision on whether the NBA chose to put their bubble in the state.
Well, statistically, New York and California does not look good. Statistically, New York and California, and they're supposed to be the most responsible ones. Those two states didn't look good. All I'm saying is, from my end, in a space where I sit there and I listen to you and I learn, I say, oh my gosh, okay, I had no clue about that. That was brilliant. That's interesting. Let me go research. Let me go look at this. I'm a guy that likes debate of experts in two different sides and let them make the argument. And I'm mature enough to know the better salesman doesn't necessarily have the better argument.
Good. But let me just say that there's nothing I've said in the last half hour that is a debating point. All I'm telling you, well, you can debate whether you should still be able to work and put other workers at risk for not having vaccinated. You can debate that.
Yeah.
In the context of public health, that's a risk factor that we don't want to introduce to other people because of your decisions. That's a public health issue that's been going on basically for 100 and something years since, who's the woman who, there's some famous medical case, a person who spread, what is that case?
Recently?
No, 100 years ago.
Oh.
It created a whole wave of sanitation
about.
Rules and things for public health sake.
I'm not familiar.
But anyway, the point is, I want to make sure you can focus on the 1,500 people who died after the vaccine.
Mary Mallon? You talking about the history of typhoid fever?